CrossFit Precision Care, we announced it last week. It's a partnership between CrossFit and a precision medicine company called Wild Health. And how this came about was when I first met Eric more than a year ago, July of 2020, and we just connected on what the direction of health and healthcare within CrossFit should be. So I've been involved in the CrossFit Health movement since the beginning and teaching seminars to physicians and really trying to help educate physicians about the core methodology of CrossFit, helping them to network and support each other and share best practices about what they were doing in their communities and really spotlight a lot of the problems with our modern healthcare system. And Eric and I both just agreed that CrossFit, unlike any other fitness company, is in a really unique position to be able to provide healthcare. CrossFit, I think CrossFit affiliates already are providing the best healthcare out there just by nature of doing what we do and in the basics of constantly very high intensity functional movement and the basics of our nutrition prescription. Our communities, we are just like, Greg Glassenow used to say, these are the oases of chronic disease. Like, this is where we create health. And to me, that was really apparent when I was my first year of med school, when I was exposed to what was actually happening in a primary care office versus what was happening in a CrossFit affiliate. It was so obvious that what's happening in our affiliates is truly creating health in a way that is just not possible and is just not happening in the healthcare system. But we connected on the fact that this is what CrossFit has always done. We've always been rooted in health. We talk about at the level one, we talk about the sickness, wellness, fitness continuum. We talk about what is fitness, what is health, and like no other fitness program, CrossFit's always been really rooted in that. It's not just about, looking good in the mirror. It's not just about these gimmicks. It's about how do we truly create health so that over the course of our lifetime, we're going to have functional capacity. We're going to be able to have good quality of life and do the things that we want to do as we age. And there's a lot of frustration also, I think, from trainers, from members of CrossFit affiliates on their actual health care in the traditional healthcare system not matching with what's happening in the affiliate. So actually being in conflict where they're going to the doctor and the doctor is telling them, stop doing CrossFit or you're going to get injured or it's too intense for you because of, misunderstood perceptions about what CrossFit is. And so there's some frustration there. And then there's this opportunity to also really bring to life what we've been talking about for so long, which is, when we're talking about the continuum, sickness, wellness, fitness, what about all of your health markers? Our performance markers we're tracking all the time. We can tell where we fall. But can we actually start looking at our health markers as CrossFit? Can we look at things like bone density, like insulin resistance, like triglycerides, things that we've been talking about? Can we actually start looking at those numbers? And can we actually start to really bridge this gap between what's happening in the affiliate and then what's happening in the healthcare system? And so, and by bridging that gap, by, bringing that primary care to life, and then also really working with our amazing CrossFit community and all of the specialists that we have too. So we have a huge network of specialist physicians, all types of healthcare providers, whether it's physical therapists, chiropractors, nurses. We want to mobilize the entire CrossFit community because what we're doing in CrossFit is providing the very best healthcare possible. So how can we actually bridge that into our healthcare system? So anyways, we connected on this idea that CrossFit's really uniquely positioned to actually provide healthcare and bridge this gap. And that's kind of where we started. And then over the course of time, we started talking with the company Wild Health. It was started by two emergency medicine physicians who had been doing CrossFit, or they had started CrossFit around the same time I did, 2009, had similarly been fed up with the conventional reactive nature of the healthcare system, and had started this practice, which really focuses on the root causes of chronic disease, focuses on lifestyle factors, and then brings a precision medicine element to it. So not only are we tracking our lab data and our biomarkers, but also looking at what additional insights can we gain by looking at our genomics to help personalize our approach. And that's certainly not the not the foundation. That's something that we can gather additional information that can help guide us, but it's not the end all be all. We know that our genomics are constantly interacting with our environment, and it's really the basics, getting the basics in place first, that's the most important. So over time, we started just talking about how we might be able to create a real primary care system that would serve the CrossFit community, and be able to pair members of the CrossFit community with a doctor who does and understands CrossFit, and also with a healthcare team, care coordinator, and a health coach who can help them navigate this precision medicine approach, and implement that into their life. And that's sort of how this partnership came to be.